And again, welcome to Digital Health Days, to Dina Mina show, where we're excited to have the opening keynote speaker of the day, Dr. Brian Goldman. Welcome.
Happy to be here.
And I'm honored to be here in between two medical doctors that will really have some meaningful discussions and follow up on your previous presentation.
You mean you're not a doctor?
Not me, but my colleague on the right, yes.
It's quite a sandwich.
Okay, so I would start by quoting one of the things that you mentioned earlier during your very interesting presentation. You highlighted that doctors are not well trained to treat chronic diseases. How do you think digital health or e-health solutions could help improve that?
Well, certainly what digital health can do is provide patients with tools so that they can manage themselves. And you know, I think one of the things that I'm getting from the presentations that have taken place today so far is that doctors tend to think about what happens in the doctor's office with the patient is the most important thing. Mm-hmm. So patient sees a doctor for 5 minutes, as I talked about in my talk, for 5 minutes, once every 8 weeks or 12 weeks. And then they just go home and disappear. Well, they don't disappear, they live their lives. And if they live their lives, if they monitored their health better, if they monitored their weight, if they monitored what they ate, if they have diabetes and monitor their blood sugar and could take more concrete steps to follow the instructions that their doctor recommends, then you're going to have a better patient. You're going to have a patient who doesn't need to see a doctor. And isn't that the point of it all?
Yes.
Unless, of course, you get paid to be a doctor, then you're going to be unemployed.
But then the follow-up question will be, in this new era of digitalization of healthcare, what is required to take this digital education further, to really educate people to live in a new context?
I think you're going to need three things. Mm-hmm. The first thing you have to do on a very basic level is to educate people. It's called health literacy. It means this is a society-wide project where kids as young as 3, 4, 5 should be learning about the determinants of health, that it isn't going to a doctor that makes you healthy. It's clean air, clean water, your social connections, your level of education, and how to develop healthy habits at a very young age. Because once somebody is 25 or 30 or 40 and has unhealthy habits, they're a couch potato, they eat the wrong foods, they eat too much food, they don't exercise, it's very hard to undo those habits unless, of course, they have a health crisis, a heart attack, and then they're very good at, they might be very motivated at that point, but better to make it normal to be healthy from a young age. So that's the first thing you have to do. I think the other thing you have to do is beyond the determinants of health, teaching patients their connection to their well-being through taking their medication as instructed and doing the things to monitor themselves. And it should be second nature. Like my late father had severe heart failure and could never grasp the notion of weighing himself. Okay. Because when you weigh yourself, a sudden weight gain means you've taken on water. Well, why couldn't he do it? Because to him, weight was vanity. I gained weight, so that means I've eaten too much. But it wasn't. In his case, he's taken on too much water. And the point is that if he knew it was normal, if it had been normal his whole life, then he would have been saying to the doctors, so what do I have to do? So when do I weigh myself? Mm-hmm. Make it so that it becomes more proactive to do that. And then give them the tools. Mm-hmm. And that's what digital health is all about. It's going to give them tools that we have never seen before.
So you're saying that on doctor's side, on healthcare professional side, changing the way we educate is easier?
No, it's not easier because you have to change the culture of medicine. The culture meaning how do we think? What's our attitude? Our attitude is that I'm very important. Only I can help you. Imagine if a patient can help themselves, then they don't need me anymore. So that's that insecurity that we have, that we will lose our patients if they're too well. I think often makes us want our patients to be dependent on us. And in the same way that healthcare has developed this team-based approach, where it's not just the doctor, it's the doctor and the nurse practitioner, the pharmacist, the registered dietitian, the exercise trainer, the health coach, what have you. They are now part of a team. The doctor doesn't feel they have to do it alone. In the same way, bring the patient and their family into the team.
Great. So,
Well, we really hope that digital health would provide tools for people to be able to handle this and also discuss mistakes and discuss shortages in the healthcare.
thank you for your optimism and for coming here and giving this inspirational talk. We
My
hope to see you in Stockholm next year as well.
My pleasure. I'd love
Thank you
to.
very much.
Bye-bye.
Thank you.